Okay, so when we have like an immediate reaction, you know, one of the things that happens with allergies, we get a lot of this produced, histamine. And so like during times of like, I don't know, like spring or whatever, and we've got like the hay fever and everything, this is something that's getting produced, this histamine, one of these products, and we usually end up taking an antihistamine to try to, you know, control the reactions that we're having. And so we get that little allergen, and that little allergen just creates a whole lot of trouble by connecting to the receptors on the cells.
Isn't it when you have a lack of protein, I guess one of the products that we make is from histamine?
Now, when you say like a lack of protein, like a lack of protein in the body, or the ability for it to be made properly by the cell?
I guess the ability to be made properly by the cell.
Well, like when people have allergies, they're usually not being able to fight off that pathogen, which would be those proteins.
Okay.
And that's why like the antihistamine will help, because what it'll do is it'll go in and it'll block or attack the histamine that gets produced, and you don't get those effects like, you know, the runny nose, the sneezing, the itchy watery eyes, and that sort of thing. Because your body's not being able to handle that itself, so that antihistamine comes in and does it for you. Now, when we begin to look at what can happen in our bodies, the biggest majority of what we're wanting that defense system to do, we're wanting that defense system to fight a pathogen that's trying to enter, okay? Now, we have situations where things can happen and the body's going to attack it, but we really want the body to accept that foreign object. Transplants are huge now, okay? That's something that we hear a lot about. The heart, I mean, look at it. Heart, kidney, liver, pancreas, bones, lungs, skin, cornea, bone marrow. When someone has to have a transplant, we want it to be successful. And the way that it gets to be successful is the body doesn't reject it. And when the body rejects it, that means the body attacks it, and then it has to be taken out and the whole process started over again if the person survives. So when the donor gives an organ or tissue or whatever the case might be, and the recipient, if their body recognizes it as foreign, we get a tissue rejection reaction. It resembles a lot of what we see the body trying to fight a pathogen. Now, one of the things that happens, the people who get certain types of transplants, they may need to stay on immunosuppressive drugs for the rest of their life, okay? Now, this means their entire immune system is being suppressed. So they're more susceptible to getting a cold or getting the flu or getting a virus, okay? They have to be a little careful, especially depending on what their immune system was like before they got the transplant. One of the things, however, that they've come a long way with the transplants, they are now matching these transplants down to the actual proteins between the donor and the recipient. And so it's making transplants be a lot more successful than they used to be. When we begin to look at the types of transplants that we have,
I'm a little confused about the protein. So to me, sound like protein is like those related to DNA.
yes, and see, which is a good question, because I think a lot of people are not fully aware of proteins in our bodies. Say, for example, the protein insulin, okay, is my code, the DNA code, the same as yours? Yes, it is.
But everybody has the same DNA strand. I mean,
Your DNA, like between each one of us in this room right here, over 99% of it is the same. Now, what I'm saying is, okay, it's because our bodies have to make proteins all the time. For example, insulin, glucagon, lipase, okay? We all have to make it, right? The code to make it does not change from me to you. It's all the same. That's how we make medications. It's how we cure diseases, because there's no difference in that. So how is it that we are different?
that's how you process it.
Mm-mm. How is it?
Oh. We have the gene.
But mitochondrial DNA is kind of important in your body. Okay? The reason that we're different, okay, is because you have non-coding DNA that is specific only to you, all right? And then the alleles, or the traits that you inherited from mom and dad, give you the traits that make you you in the mirror, okay?
The 1% is that
Less than 1%, actually less than 0.0001%. Yeah.
because we all made up of the same stuff.
Yeah, because you got eyebrows, I got eyebrows. You got eye color, I got eye color. I got a nose shape, you got a nose shape. I got ears, you got ears. Got hair. Wavy, curly, straight. It's a matter of those alleles. But they're the same. It's a matter of how they combine. But then the part that is just strictly to you is your non-coding. Everything else, like all these proteins that we need to make our body work, are the same. They're all coded the same. Isn't that cool? Y'all didn't learn that in part 1? Okay.
I knew that we were all the same.
Yeah, it's
I know
really,
the why. What's that?
Like understanding how the protein, I know protein has a lot to do with the body, but I'm like, how is it all the same cultures, DNA?
and people, in case, I don't know like what they might have taught part 1 for, your professor, but a lot of people don't like to hear that number is very close between us and other species. Yeah, and it's the reason that these not FARM, but PHARM, the pharmaceutical animals, pigs are the ones that are closest to us. People don't like to hear it, but hey, it is what it is.
So as far as like insulin, because you can have, your pork, you have your beef, and then now they've made the ones that they're coding for DNA. But my question is, so some people are reacting to some insulins as opposed to other, or it's taking longer to process, which is why you use this insulin as opposed to this insulin, but it's person specific and they don't know till they try it. Is that
Now,
1%?
To my knowledge, the insulins that people receive are no longer gotten from other organisms. They are all strictly made in the lab. Okay? The difference is they now have all these ones that are fast acting, slow acting, pill, injected, and that's, I think, what the people have a problem with, being able to adjust to fast acting, slow acting. Is it in pill form? Is it injection? But so far as the actual medication itself, it's all bacterial based.
But some people, like there's different, you can have chemo, but you could have a regular insulin that acts at the same time. That you can have two different brains that are slightly different, and someone's going to react better on this one than this one. When it's pretty much almost identical, but the preservative's different. So it's the reaction to, I guess, the preservative that's the problem.
Right, the other ingredients in the medication. And you can actually see that in other medications as well. For example, let's say you have a medication that you have to take. And when you were first given it, you were being given the one that's not generic because maybe it had just come out, okay? And then all of a sudden, they switched, that they've had their patent done, so now other companies can start making it in a generic form, and because they'll use a different filler, not the actual chemical, but a different filler, you'll react to it. Yeah, so it's very interesting what happens. And so the different transplant types, we can do iso, auto, allo, xeno. So depending on what needs to be done, okay, like say a skin graft or anything up all the way to an organ, iso means the same. And the donor is usually yourself or an identical twin. Autograft, well, auto self, like maybe you have a bad burn here, but they can take skin from your leg and place it here, even though they're having a lot of success with the artificial skin now. Allograft, from the same species, getting that kidney from a relative or a very closely matched donor, because the relative is really your best bet for an organ. Well, you can't say organ, got to say the kidneys or something like that. Xenograft, different species. For example, the heart valve from pig. If you ever have to have a heart valve replacement, always take the pig one. Okay, don't use the artificial one. Now, when we have things go wrong with this system, we usually end up having autoimmunity. This system cannot distinguish something foreign from the own cells, your self cells. It's an autoimmune disorder. It's bad, okay? Some things that can happen with autoimmunity can be very life crippling. When we have this take place, okay, basically we're attacking tissues and organs of our own body. Here are some examples. Glomerulonephritis. This is the kidneys. Graves' disease. And ever known anybody with that? Okay. Thyroid. The diabetes is autoimmunity. Hemolytic anemia. That's bad. Okay, if you get diagnosed with that, that's bad. Multiple sclerosis, MS. Myasthenia gravis. I did look it up. Pernicious anemia. Not good either. Rheumatic femur. Rheumatoid arthritis. That's got lupus. Ulcerative colitis. These are just some that we have. They've come a long way with medications for autoimmune disorders. Like, for example, the guy that does the golfing, Phil Mickelson, okay? And he talks about the psoriatic arthritis, really painful from what I can understand. And then I love how they talk about the medication for that, the biologic. Have y'all ever paid attention to the term they use? Next time you see the commercial, pay attention to that. Because I'm just like, how many people are going to know what that is? Okay? It sounds fancy. Yeah. I'm going to go talk to my doctor and ask about the biologic. I'm going to do that. And the doctor's going to be like, do you really know what that means? Do you know what that means? it's going to be something that's going to suppress your immune system. And you need to be aware of all of these other things that can come along with it. Because they talk about the major side effects are, and they list these side effects, and I'm going, okay, that's worse than the disease. Okay? And it's because you have suppressed the immune system and you are more susceptible to anything that's out there. Anything. So, the immune system, over time, okay, like I said, it is going to decline because of the thymus shrinking. For me, okay, because I don't, I'm not a fan of vaccines. Okay, I know that they are needed, I understand that, but for me personally, no. Okay, so I feel that it's better for me to develop my own immunity so that my thymus gland can produce as many T cells, and then if I need it, my bone marrow to produce as many B cells as needed to take with me into my old age. That's my goal. Sean, do you have a question?
I do. So what's the autoimmunity? So the cells are, the antibodies are attacking the body, so the cells are attacking itself.
Yes, they are attacking your own cells and organs.
So is it eating away the good nutrients, or is it literally
Okay, let's look at one for example. Everybody's heard of rheumatoid arthritis, right? Arthritis, period, just overall. Arthritis occurs where? In the joints. Now, people who have just regular osteoarthritis, okay, they tend to have the soreness in the joints, the stiffness in the joints. But with rheumatoid, which is an autoimmune disorder, the actual joint itself the tissue is being destroyed and replaced by bone. And the joints actually lock. So however that locking might occur, that person can never move that joint again. Yeah. The rheumatoid arthritis? MS, right. It's attacking that myelin sheath and basically making that nerve no longer function correctly. And those people are going to have, and it's the sclerosing. It's like a scarring, and so it makes makes it not work.
So is this rather than fluorescent stuff?
Yes.
So that means that the T cells and B cells, are they always present within
Yes.
the lung?
They'll always be active.
Always active.
Yes. And they have medications. They have medications that will suppress it. And usually what happens is if the person can get it under control, they'll end up having flare-ups. And so like people with rheumatoid arthritis, they might go for a really long time, not have the pain and the stiffness and stuff, but then they'll have a flare-up and it'll show up in their joints. So yeah, autoimmunity is pretty rough. Because our immune system is declining as we get older, our risk of infection and cancer does increase because those cells are no longer as effective as they used to be. Our antibody response to an antigen gets less. The IgA and G begin to increase where M and E decrease. And that's a bad situation for our body. And because as we get older and we have all these changes take place, we might not be able to be approved for like an organ transplant because we wouldn't be able to be placed on those immunosuppressive drugs. So it's kind of a lose-lose situation. But that actually ends chapter 21 for us. Whoa.